Thank you very much, Molly, and thank you, huge thanks to our presenters. It's amazing work that you're all doing, and I will be as quick as I can because I'm sure you've got lots of questions. I think with the quality of those presentations and just the kind of absolute, why are we not doing this? I think our ambition in London is to make sure that this sort of personalised care is available to everyone in secondary care. It's there in pockets. And I know it's there in to a greater extent than the 3 presentations we've had, but it won't be there right the way across London, and it makes sense on many levels, doesn't it? So there's a few reasons why we think it's important here on the slide. So bridging the gap between primary and secondary care, and we're all about integration and linking up now because we know that gives better care for the patients and the people we are on this earth to care for. Building and strengthening also the partnerships between the NHS, local authority and the voluntary sector and communities, really important. And I think that's become more important post-COVID, hasn't it? We need to understand what's going on in people's lives in order to support their better health. So if we can do that through personalised care roles, then we are in a better place. I think one of the things we need to be doing is doing it with communities, tailoring secondary care services to patient and community needs. So I think that engagement is massively important, and that's through the presentations this morning we've heard how that's happened and how valuable that is. Obviously, the non-clinical wider determinants of health have been repeatedly mentioned as something that we really need to understand in order to help improve health in our communities. I think education and awareness of services and the risk factors is something very obvious that this will do. I think I'm teaching, I assume, to be converted here, and all 134 of you, there have been more, but I think we need to spread the word and just how important this work is. And I think increasing the trust and patient experience improvements will be an outcome of this work. That right care, right time, right place. We've been saying that for a long time. I think it's making sure that we're using our resources, and they are dwindling resources in the NHS, it seems, doesn't it? Making sure that we're using the right resources at the right time of that patient pathway. And reducing health inequalities. We're all about population health, recognising where there are inequalities for individuals and communities and addressing those, and this has a really significant impact on that. And improving workforce retention by improving patient experience and outcomes is something that we are also very concerned about at the moment. So on the next slide is just some things that perhaps we will be asking you to do in order to make that a reality. We need that London-wide commitment, and I think in organising this today and talking with you, asking you to share your stories, and having the panel session next week and unpick some of those issues that you've heard about and not quite sure, I think that's part of it. We would like to see a personalised healthcare lead in all acute community mental health and specialist trust to act as a point of contact. We need champions. We've got lots of them, you included, around London at the moment, but we need more, and coming from all the different parts of the NHS. We need personalised care and MEC, making every contact counts, embedded in training and education for all clinical staff. We need the patient voice and lived experience to co-produce and share personalised care interventions, and that cross-sector collaboration and partnership, taking a systems approach, again, exactly what the NHS is doing at the moment, one of the priorities. More consistent funding and investment in personalised care. I'm afraid we haven't got any huge giveaways in cash at this point, but I think the argument is so compelling. I think we need to be thinking locally, system-wise and regionally, just how we enable that to happen, for that investment to be made, and clear guidance and policy and strategy for personalised care in secondary care, and the team will be providing that. So we've all got a part to play in that, in driving this forward. The next person you talk to after this meeting may be the key that unlocks something in your bit of London. as I say, we need to be looking at both at all levels, local, regional, and system level, to do that, and we need to be doing that at every opportunity we can. And a suggestion there is creating your own ambition statement for expanding personalised care provision in secondary care. I think, Molly, you're asking to share in Slido. Are we going to do that now, or move on to the panel, or we can do both at the same time probably? But this is a great session. It's absolutely the right thing to do, and I think now we have to do it, and we have to be creative in thinking about how we do it. Thanks.
Thanks, Jane. Yeah, so we do have the opportunity in Slido, so we've just popped the link in the chat for you to put in your own ambition statements around personalised care and secondary care. So please do share that in there. And thank you so much, Jane, for really brilliantly kind of sharing why it's everyone's business really to be thinking about combating health inequalities, and how we can do this more effectively together to really kind of achieve our ambitions in this space. So thank you so much.